Hello, my name is Patricia and we're coming to you from the Positive Resource Connection. I'm sitting here with
Kyrie. I'm Charity.
and we are part of the outreach. We're part of the outreach here at the Positive Resource Connection. Once again, located at 525 Oxford. We're on the corner of Oxford and Monroe, which is actually 2 blocks east of Southside High School's football field. We go out and do different presentations, and during those presentations, we also do free, confidential, and anonymous testing. And Charity's going to tell you a little bit more about that.
So our free and confidential testing offers free HIV testing and hepatitis C testing. Currently, because of COVID, we're only doing HIV testing and hope to get back to doing hepatitis C testing soon. Our testing is very quick. You have instant results. Our finger stick just takes a few drops of blood and the results are in 60 seconds. Our other test format that we use is an oral swab, and that one takes a little bit longer, but only about 20 minutes. And like I said, the test results are instant.
If testing is something that you're interested in at this time, you may still do so by appointment only. And that's a matter of either giving Charity a call or Ken a call at 744-1144. Once again, we're not taking any walk-ins at this time. It's by appointment only.
Right.
Okay. So let's talk a little bit about HIV, AIDS, how it's transmitted. First, I'd like to start off by telling you what HIV stands for. HIV stands for Human Immunodeficiency Virus. It's basically a virus that attacks the immune system in humans.
Right.
We're going to talk a little bit more about those fluids, but one of the things I want to get off the table is oftentimes people use HIV and AIDS interchangeably, but they're actually 2 different things. Once again, HIV, Human Immunodeficiency Virus, is a virus that attacks the immune system in humans, and AIDS is basically a diagnosis from the doctor of the person that has HIV stating that the immune system has been compromised or depleted due to HIV. Okay? The good news is neither one of them is the death sentence that it used to be.
Right.
With medication and medical treatment, a person with HIV or AIDS can have the same life expectancy as anyone else. But the important part is medication and medical treatment. That's something else we do here at the Positive Resource Connection. The good news is if Charity tests someone and they test positive, we don't just go, oops, yep, you got it, go over there, because we have another department that will help you every step of the way if a person tests positive or reactive to HIV.
Mm-hmm.
Okay? Mm-hmm. So let's talk a little bit about transmission. There are some fluids that transmit. You want to talk about what those fluids may be?
So there are 5 fluids. We know that when a person has HIV, that ultimately the virus is in every fluid of our body. But the difference is the concentration level in those fluids. So the 5 fluids that will transmit HIV are blood, vaginal fluids, semen, anal secretions, and breast milk.
Mm-hmm.
There's a lot of misinformation out there about other fluids that might transmit, and that's saliva, tears, urine. But all of those are a low concentration of the virus itself, so there's not enough virus in those fluids to transmit anything.
Small concentrated amount of virus in those fluids, other than the 5 that Charity mentioned. Okay, so let's start off by talking about breast milk. Now, as we know, breast milk is usually transmitted mother to child. So if a mother is pregnant, it is now mandatory here in the state of Indiana. It's been mandatory in other states long since, but here in Indiana, we are a little conservative. So it's kind of new for us. If a woman's pregnant, she is tested. And if she tests positive for HIV, the doctor will then give her a medication that she takes during the pregnancy, and that will prevent the baby from being born with HIV.
Now, can the baby still get HIV through the breast milk itself?
That's a good question. Oftentimes, if that mother is pregnant, the doctor will give her the medication and she will be asked to not breastfeed that child. Even if she's taking medication, she will not be allowed to breastfeed.
And the reason is mainly is that they just don't want to put a baby at risk.
Right. Okay. Good one. So let's move on to blood. Okay. There are different ways that we could come in contact with someone else's blood. But what we need to keep in mind is, first, one person has to be HIV positive. So sometimes people get a little, up in arms about blood itself, but someone has to be positive in order for that to be transmitted. Now, let's think of some of the ways that we could come in contact with someone else's blood. Needle sharing, for
Needle
example. If I'm a person that's an intravenous drug user, I use a needle and then I share that with someone else, my blood can be right in the barrel of that needle. And when they use that needle, they could be putting my blood directly into their veins.
Right.
Now, people will ask things like, well, what if I take a lighter and heat the needle up? Or what if I do this or what if I do that? Now, there are actually only two things that kill the HIV in blood. One is said to be 60 to 90 seconds worth of air, which actually gives the blood enough time to dry out, which may kill the virus. But if that blood is in the barrel of a needle,
It doesn't dry.
it doesn't dry. And the other thing that kills the HIV in blood is bleach, the chlorine in bleach. If a person is using a needle and they use bleach to shoot in their arm, they're gonna have a whole nother problem. So what bleach is best for is cleaning up blood spills,
Right.
okay? So those are the things that kill HIV in blood. Can you ladies mention some other ways that we may come in contact with someone else's blood that we haven't mentioned so far?
Open wounds, coming in contact with blood and open wounds.
Yep, and with that you would need 2 wounds and direct contact, and they would both need to be open. Which that is a low risk for transmission, but it is a risk.
And one of those people has to have HIV
Right.
in order for that to be transmitted. If there's no HIV, there's no HIV transmission.
Right.
Okay. Things like fighting, that's another way to come in contact with someone else's blood. Say for instance, I have HIV, someone punches me in the mouth, they slit their knuckle on my tooth, I have blood, and now they have an opening away from my blood to get into their body. So fighting is definitely a risk.
Right. Another one, again, a low risk, but if you come up across an accident and we see someone that has a head wound, and our first instinct is to stop the bleeding and put your hands on there. We all work with our hands and have tiny little cuts, paper cuts, things like that on our hands that could possibly be an open wound. And when you put your hands directly on that blood to stop the bleeding, you're possibly putting yourself at risk.
Yeah. And for some people, that's not their first instinct. For some people, they're thinking, oh, I'm not gonna help. But I wanna re-ask that question. What would you like for me to do if you were hurt?
Right.
What I am going to do is, first, I'm going to get a protective barrier. And what would be ideal would be gloves, rubber gloves, plastic gloves, or something like that. Anything that protects the hands. But not many of us travel with things like that, so we can improvise. Things like our shirt, our scarf, anything that serves as a protective barrier, a garbage bag,
Even your shoes.
even your shoes. So I said a shirt. So if I use my shirt to apply pressure and my shirt gets blood soaked, I'm not going to want to handle that blood soaked shirt. So then I would take my shoes off, as Charity said, and put my hands inside the shoe to protect my hands from the blood to blood contact.
Right. Right.
Did we cover all blood to blood contact? I think so.
I think so.
Okay. Well, the other fluids are sexual fluids, vaginal fluids, and semen. Okay. We know the ways to come in contact with those fluids are through sex.
Yep. Unprotected sex.
So a way to avoid that is to use a protective barrier that will reduce the chances of coming in contact with HIV. But if you are looking to eliminate your chances for coming in contact with HIV through sexual contact, abstinence is the best way, okay? Not coming in contact. Now, I oftentimes have people describe to me, well, what if I do have sex this way? Or what if I have sex that way? If you're having sex while standing up, you're still having sex.
Right.
That's one of the questions I get. What if I'm standing up? You're still coming in contact with someone else's fluids, okay? If it's wet and it's not yours, try not to come in contact, okay? So then anal secretions are one of the other fluids that we talked about. That's anything that comes from the anal area. So anal sex can pose a problem, or applying oral stimulation to someone's anus is another way to come in contact with those fluids.
Right.
Okay. I think we covered all the transmissions.
So what are fluids that are not going to, what are some things that are not going to put a person at risk when they think about bodily fluids and a person's behavior?
Right. I guess you mean like things like kissing.
Yeah.
That's not going to put you at risk. Here's something yucky, a nice fact. Don't know who did the workup on this, but it is stated that in order to get HIV from someone else's saliva, you have to drink 5 gallons of someone else's spit. And that's not possible, because if you're kissing someone that's drooling that much, we're kind of asking for problems.
Yeah, there's a whole other conversation that needs to happen.
There's a whole other conversation. So kissing is not one of those things that transmit. Hugging is not one of those things that transmit. Hand holding, and a nice flirty text. That's not a way to come in contact with HIV either.
So sweat,
Mhm.
saliva, tears, urine, all of those things are completely safe.
We talked about protective barriers. Here at the Positive Resource Connection, we pass out free protective barriers. We have female condoms, male condoms, dental dams, lube. It is just a matter of coming into our office and asking the front desk if you may have, and we pass them out. Okay?
Free.
Free. Free. Free. We're going to talk a little bit about, do we do any more coverage about harm reduction other than protective barriers, knowing your partner, asking questions? One of the things I'm a big component of, if as an adult you are preparing to get into a sexual relationship with someone else, what is a good thing to do is both you and your partner call us here at the office, once again, 744-1144, and you both get tested. And when you get tested together, there should be a conversation that goes along with that. Oftentimes, for your initial test, we may give you free protective barriers, and some couples may decide to have yet a second test, just to be sure, because there's a small window period. You want to talk about the window period?
The window period for testing is for the finger stick blood test that we use. It is a 2 to 3 month window period, and that's the same window period for the mouth swab. So when I say the 2 to 3 month window period, you think of it as it can detect from the time you were born up to 2 to 3 months ago. So anything that's going to happen that's happened in the last 2 to 3 months, we can't pick that up. So that's why we often recommend people to come back in 2 months and be retested, just to cover that window period.
And once again, a conversation is very necessary between those two consenting adults.
So what kind of questions should we be asking a new partner before we have sex and we take that step?
Their sexual history, partners, how recent the last partner was, drug user.
Right?
Yeah, absolutely.
Right. One of the things I think that's important for me, I like to always ask, is this going to be a monogamous sexual relationship?
Yes.
Because I think sometimes we take for granted if we're having sex with someone, we're the only person they're having sex with. So I ask. Now, oftentimes people say, well, a person can lie to you. Yes, they can lie to you, but you're more likely to get the truth if you ask than if you don't ask.
And then when you partner that conversation with protective barrier use and getting tested as a couple, that's all the more steps that you've taken to protect your own sexual health.
Right. Ask questions. Have a discussion. I don't know how many times I can say that. 2 consenting adults should have a conversation about having sex before sex is had. One of my pet peeves is when people tell me, oh my goodness, I went and I never meant to have sex, but it just happened. We kind of know what's happening. If we put ourselves in certain situations, that person is looking good, you're feeling good, things might go down. Right, things might go down. So protect yourself. That could be a matter of dropping condoms in your purse or in your bag before you go on that date or before you hang out with that person. Those are all things I guess we could do.
Yeah, and just be prepared.
Right, and I know it gets hard because if you're attracted to someone, the last thing you want to bring up is things like HIV and STDs, but you really want to bring it up with your partner versus having us bring it up with you by saying, I'm sorry, you're positive.
Right.
But as I said earlier, none of this stuff is a death sentence, but it is awful inconvenient. And I don't know about you ladies, but I have enough on my plate. I don't need anything else to deal with. Okay?
So when you say that it's not the death sentence anymore like it used to be 20, 30 years ago,
right.
What's changed that makes having HIV easier
right.
and more treatable compared to in the past?
Okay. One of the things is early detection. Finding out early, getting tested early, because if a person finds out early, they're on their medications, that's a little safer for them. People often ask me about like celebrities and people like that are positive, like Magic Johnson and stuff like that. Magic Johnson, for those of you that are old enough to know who Magic Johnson is, not Magic Mike, but Magic Johnson. Magic Johnson was a basketball player. He came in contact with HIV, but through early detection, he found out early. He takes his medication. Through medication, he became undetectable. Okay? Undetectable, you want to explain a little bit about what undetectable
Undetectable is when the virus, when a person takes their medication every day as prescribed, eventually what's going to happen is that virus is going to be suppressed. Meaning it's kind of just over here hanging out, not doing anything. It's basically waiting on that person to stop taking their medication.
Right.
So then it can start wreaking havoc in your body again. But while it's suppressed, it's not duplicating itself. It's not growing. It's not multiplying. And they look for this magic number when a person has HIV and they get blood work done. So they have a tube of blood and they count how many viruses in that specific tube. And the magic number is 200. So we want that person's viral load count to be below 200. That's what it means to be undetectable. And the great thing is about being undetectable is once you are undetectable, you are untransmittable, meaning you cannot transmit the virus to someone else because that virus is so suppressed.
You equals you.
Exactly.
Meaning undetectable equals
untransmittable.
Another reason why it's not a death sentence anymore, not only early detection, but through medications. There has been such advancements in medications. I remember I've been with this agency, this August it'll be 14 years, but I remember when I first started, I met a gentleman, he was taking up to 15 pills a day. He had HIV. Now, that same gentleman is HIV positive and he's now taking 5 pills per day. So that's a nice reduction in medications.
But that's got to be huge on how it impacts his life and really makes that person actually want to take their medicine because who looks forward to taking 15 pills a day?
No, not at all.
Right.
Not at all. Now, we've talked about medications. Now, one of the things that people often say is, what about the price of those medications? They are pretty pricey. But once again, that is something that we can assist people with here at the Positive Resource Connection. It's a matter of a phone call, calling to get information for that. Okay? For that service. Co-infection is another thing we see. Co-infection meaning sometimes people will come to us and they'll have HIV and herpes, HIV and syphilis, HIV and gonorrhea. Now, we understand that because oftentimes the same way we could possibly come in contact with HIV are the same ways that we can come in contact with gonorrhea, herpes, and things like that.
Right.
So once again, visiting a doctor, knowing your body, checking yourself. Self-examination is also important. And I often say, and I know this is hard for a lot of people, but when we have a partner, especially a new partner, take a look.
Right.
Take a look at their body and see what's going on, because it's not so much that people are out here maliciously trying to transmit things to other people.
A lot of times they just don't know.
They just don't know. They don't know. And you might be the person that clues them in. Hey, there's something there that doesn't look right, or that's something you should possibly get checked out. And it's not offensive because not only are you looking out for your own sexual health, but you're now looking out for your partner's sexual health as well.
Right.
So co-infections is a thing. So once again, the only 100% way of not coming in contact is through abstinence. Not doing it, not coming in contact. Another good thing to have in your life is a regular testing regimen. Okay. As I said, 14 years here, and I remember I had never gotten tested until I started to work here. It took me 6 months to build up enough nerve to just walk down the hall to get a test.
Wow.
And back when I started to get tested, it was a 2-week waiting period.
Oh, wow.
Yeah. Once again, it's now
60 seconds.
60 seconds.
That's amazing.
How I would have loved to have had that. But that was the longest 2 weeks of my life.
Yeah.
I thought about everything I did, everybody I had did. I thought, I was just totally paranoid. But here's the deal. Once you educate yourself around HIV and AIDS and you start a testing regimen, every July is my month to get tested.
Mhm.
That's something I don't worry about anymore, HIV and AIDS. And I'm a mother, so I worry about a lot of things. But HIV and AIDS is not one of those things. Get yourself educated around the topic and get yourself tested.
And being tested, it's a very quick and easy, painless step to take.
Mm-hmm.
And again, it really puts you in control of your own health.
Yes.
Mm-hmm.
Yes. I talked a little bit about co-infections with STIs or STDs. Now, we usually have an STI clinic, but once again, because of COVID, that's changed. But what we recommend, if you have some questions or you have some concerns, you can always reach out to the Allen County Health Department.
Right.
Okay. I want to tell you their phone number, but I can't. Google it. I can't remember. It's 449 something. Google it. So you can take care of your sexual health that way as well. Protective barriers. I think I also mentioned that we pass them out free of charge. We ask that a person be at least 13 years of age or older before we give out a protective barrier. And once again, that's just a matter of coming to our front desk, asking for, and we pass them out.
And what kind of condoms do we have?
We have
different kinds.
Yes, we do. We have female condoms, we have male condoms, dental dams, lube. At some point, I think we had finger cuffs. I have to look to see if we still have finger cuffs. Mm-hmm. Those are all things that we pass out. Mm-hmm. And if you are interested in any of those barriers and you're like, female condom, how does that work? I've never seen that before. When you come and ask for that protective barrier, ask the person at the front desk to tell you a little bit more about that protective barrier. And if need be, we can come out and give you a demonstration as to how to use those protective barriers.
Right. Because I know when I first started working here, I had, you don't hear much about women or female condoms. Mm-hmm. And I was just really kind of blown away, like, I didn't know that was a thing.
Right.
Right. So a lot of people like female condoms and dental dams. They're not advertised as much, but like Patricia said, we will show you the proper way and get you educated on those so you feel more comfortable using those and trying those out.
Right. And one of the things that I didn't realize when coming here, I do a lot of outreach in the community, so I have condom bowls in different areas here in Fort Wayne, like barbershops, beauty salons. But what I learned from the barbershops is actually our condoms aren't all one size fit all.
Oh, right.
So what we have is we have a variety of sizes of condoms. Mm-hmm. If you want a way to determine which size fits best for you or your partner, we have someone that'll explain that to you as well. But we have different size condoms. Lube, once again. Mm-hmm. So those are all the things that we provide here at the Positive Resource Connection. Once again, if you have any questions, we can be reached at 744-1144. Okay. Is there anything you ladies want to say in closing?
No, I think we pretty much covered all the questions, and like Patricia said, if you ever have just any basic questions, if you want us to help you talk to your team or anything like that, just give us a call and we'd be glad to help as much as we can, if not direct you into a different office or agency that could cover what we can't.
Yes. Thank you for joining us today.
Hi, my name is Ken Redmond and I'm the testing coordinator here at Positive Resource Connection. You just heard Patricia, Charity, and Kyrie tell you just about everything there is to know about HIV. One thing you may not have known is that there is a pill that can prevent you from getting HIV. That pill is called PrEP. It stands for Pre-Exposure Prophylaxis. And essentially it's a pill that you take once a day that actually keeps you from getting HIV. And that is something that we actually offer here at Positive Resource Connection. So if that's something you would be interested in as well, give us a call, 260-744-1144, and we'll put you in touch with one of our PrEP coordinators, and they will get you on the right track to getting PrEP, which can prevent you from getting HIV.